with the treatment, you need to look better, more rejuvenated, and younger. Basically, we want to give you your beauty back or enhance it without creating something artificial and weird looking, I say.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Olga Voloshina, who is an ARNP, holds a Master Nursing and Electrical Engineering degree. She is founder of Best Filler Injector Educational Center. Currently, she is the medical director of Best Filler Injector Center and the Better Skin Spa. She's also an Allergan trainer and consultant and provides multiple aesthetic trainings at her center. She's very passionate about aesthetic medicine and also anti-aging treatments. So Olga, welcome and glad to have you here.
Hello, everybody. Thank you for having me.
Yep.
Yes.
So let's dive into it, Olga. How did you get interested in aesthetics in the first place?
Well, it's been always my interest. When we just started the birth, I say, of aesthetic medicine. And I am from former Soviet Union, and I started my medical career there and worked with plastic surgeon. And exhibit the big interest in aesthetic medicine. When I moved to the United States, I pursued my interest and made my dream come true. So I took multiple aesthetic trainings and started my own little business.
Great. Now, Could you just talk about some of the popular treatments that people come to see you for, and also why do you think that they're so popular?
Well, the first treatment, which is very well known and very popular, of course, neurotoxin, Botox, our famous Botox, and which was discovered during the medical procedures. We were treating some eye condition, and people start seeing diminishing the wrinkles, and then it was developed in the aesthetic treatment. And this is, I say, the gate drug for many our clients. Mm-hmm. So this is the first thing which most of our clients hear, it's Botox. And they come, they do the treatment, and then we expose our clients to another procedure. So I say still number one treatment, popular treatment is Botox. Mm-hmm. Then we have dermal fillers for volume enhancement and correction of anti-aging process. And now aesthetic medicine, of course, developing so fast, literally every day we have new treatments. So these two treatments are very popular. But then, of course, comes laser treatments, chemical peels, whatever we need for our client to start with.
Got it. Now, are there any new or emerging treatments that you're particularly excited about?
Well, a few years ago, we started using our own blood in aesthetic purposes, and you may hear about PRP or PRF, and it was used before for medical purposes. But now we have a great choice to use our own growth factor to rejuvenate our face and body.
Mm-hmm. I think it's fascinating. I'm seeing more and more medical practitioners introducing regenerative medicine, PRP, things like that into their treatments. And I think a big part of that is the shift from people wanting to look at it almost like anti-aging or being more natural. Is that something that you're kind of seeing in your practice?
Yes. Yeah. This is actually a new trend now. Every procedure we do, we're trying to look our client very natural. So it's not going to be obvious that something was done. And the other people may say, oh my God, you look so good. What did you do? And a lot of clients, they don't want to tell what they do, So the aesthetic treatments should be undetectable, but with the treatment, you need to look better, more rejuvenated, and younger. Basically, we want to give you your beauty back or enhance it without creating something artificial and weird looking, I say.
Yeah, and I think that's one thing. It seems like a fear people have is that, oh, I don't want to look unnatural. I don't want to look weird. I don't want to look like those celebrities where they just did too much.
Yes.
So, and I think that's kind of going in that direction of the more natural look. They don't want people to know that they've got anything done. I mean, what do you think is the reason behind that? Like, why do you think people are starting to move more to that natural looking, not overdone look?
There is a lot of reasons. I think we are getting more educated clients now, and they really understand what the beauty is. They want to preserve their beauty without changing it too much. I say it's healthy aesthetic mind. Right? For example, my clients comes to me and say, I see they need to do, as we age, we have 5 basic layers in our body and face in particular. So every layer undergoes some, changes, and we want to restore it. So a lot of people, losing volume in cheeks, for example, lips. So the client comes for consultation and they asking, what can you recommend for me to do to look natural and younger? So, of course, we start with the treatment plan, and for example, the easiest topic, lips. So we're losing lips as well as we get older, and it, as men as women, the same thing. So I say, we need to do this, this, and this, and of course your lips. And the first feedback I hear, I don't want ducky lips. So that's been a bad trend in aesthetic medicine when people are afraid to look weird, to have ducky lips. So I always respond, listen, I'm not going to give you ducky lips. I'm just going to give your lips back. Like just to return something which been lost in time. Yeah, so I think it's, some providers which creating this unnatural look, not giving a favor to this part of aesthetic medicine. Yeah. Bad name, I say, and bad face for that.
Yeah, and I'm sure that this kind of leads to a lot of misconceptions that people have about these treatments. So what are some common misconceptions that you'd say that your clients, your patients come to you and they have this wrong idea of how the treatments work? What are some of those common misconceptions?
Well, as I mentioned, lips, right? Or when we, for example, using neurotoxin as Botox or other neurotoxins, they think they're gonna have frozen unnatural look. I don't want to be frozen. I don't want to have any, not to have any expressions. And it could be done that way when you still look natural, you don't look frozen, and you still have expressions. Or we're trying to restore somebody's volume, like for example cheeks, or create a nice jawline or chin, and people say, oh, I don't want those big huge cheeks, I'm not gonna look natural. So that when the part of education comes, when we are restoring the mid face, in particular cheeks, the client actually not supposed to look like they have big volume in their cheek. They will look skinnier and more lifted, but it has to be done in the right way. So we're bringing another issue in that we need educated aesthetic providers, knowing what they're doing, knowing how not to change in the wrong way the client's face, if it makes sense what I'm saying.
Yeah. And that kind of leads me to my next question, as far as I want to talk about what differentiates your practice from others in the industry. I know that you have a very strong team and they have continuing education that they're really dedicated to. So can you talk a little bit more about that, like your team and really what makes your practice different from others?
So first of all, we are looking at anti-aging aesthetic medicine as a natural, rejuvenation of our clients. So people who've been, I'm working with already for 20 years, they all know me for creating the natural lifted look of their faces. They trust me and they come to me. So the strengths of our team that we're continually doing continuing education. So we're reviewing all the newest procedures in the field. We every month we have training days for our staff. So we go over the new techniques. We're reviewing the literature. So because we need to be on the top of aesthetic medicine. Because literally, as I said before, every day we are creating something new. Not we are in particular, I mean the aesthetic medicine experts. So being on the top of that, it's very, very important. And of course, we need to look confident for our clients. We have very educated clients population now. When they come for your services, they know what they want. They read, they educate themselves, and it's good for us, makes our job easier, but we need to look confident as well. We need to know what are we doing. So I say that education as a part of every practice is very, very important.
Now, you talked a lot about the education for your providers and your team members. So how do you take that and how do you approach educating the patient about the services and the benefits of what you offer?
So before we start doing anything with our client, we always schedule medical consultation. So when client call us, for example, this is the new client and they want to do a certain procedure and like schedule me for that and that. And our staff is, trained not to schedule that particular service without having consultation, because the client may think about one thing, but they need another one. So we have treatment plans for different skin condition, for different ages, for different skin types. So we kind of have those algorithms already ready for our clients' population. So our medical consultation is very thorough. So there is always the priority, what needs to be done first, and then it will lead to another procedure. We review the aging process, what's been lost, I say, what we still have good, what we can enhance. So it's not that easy what we think, aesthetic field is very easy, I'll just do Botox and this and I'll be done. No, this is maintenance. It's not one treatment done and ready for many, many years. No, it has to be a continuous process. Every year, we need to do certain time of procedures, and every day we must use in some products. Mm-hmm. So medical consultation is very, very important, and that's where we educate the client what needs to be done and what's going to be planned for a future life for that client.
Mm-hmm. Now, you did mention that it's not as easy as maybe people think about it's just do it once and you're good for a long time. So what are some of the other difficulties that you've experienced as far as practicing aesthetic medicine, providing these treatments to your patients?
So the difficulties, maintenance, of course, because, for example, neurotoxin needs to be done every 3 to 4 months, right? You have to use the right products. For example, for everyone, this is like 4 main products which we need to use every day: vitamin C, retin A, moisturizer, sunblock. This is the basic stuff. And then comes along much more things. So for a lot of people, the maintenance, follow-ups, appointment, coming regularly to the clinic, it involves time and financial part. So to provide great outcomes, you have to have maintenance. But for, I say, good half of our clients, it's been a challenge. So, yes.
Now, when it comes to when you're actually doing the treatment for your clients, how do you balance between providing that relaxing experience for them, but at the same time ensuring their safety and well-being?
Of course, we need to be, again, well educated about what are we doing and follow all the safety precautions, providing the very careful training for the person who starts practicing aesthetic medicine is very, very important. We use ultrasound. We use, for example, vein viewer to see where we have major blood supply, not damaging that. We're using the right dosing of our medication. And there's on-label stuff, there's off-label stuff. We need to be familiar how to take care, because complications do happen. That's why we have consent forms. That's why we're signing and explaining everything to the client before the procedure. But complication do happens like everywhere else in medicine. We're all different. We all have different medical conditions. But we need to know what to do when complication happens. We don't want to look surprised or feel frustrated. Oh my God, what I'm gonna do? You have to have a protocol what to do. So you have to be prepared for that, because we all want to sleep at night without thinking that I did something wrong.
Mm-hmm.
So we have safety equipment, we have algorithms how to manage the complications, and of course we educating the client what can happen and how we can escape that.
Got it. Now, Olga, when it comes to medicine, people think that there's a process, there's a procedure, there's a step-by-step that goes into it. But what role do you believe that creativity plays in how you approach your patient care?
So it's a good question. That's a good question. So, for example, let's talk about, giving you an example, treating brown spots. So a lot of, especially newer providers, they will think right away, oh, let's do laser. So we don't think how we can prevent that and what else we can do to manage that. So we're gonna treat our client with the laser to diminish the brown spot. We're gonna recommend sunblock, and sunblock should be used every 2 hours when you're outside, no matter whether it's raining or not. We still have UV rays exposure. We would recommend certain products to suppress melanocyte activity, not to create the brown spot. We will recommend the treatments beforehand, before they see that condition may appear. So this is the long process, and I will divide it to prevention of the condition, educating the client what to do. Then if we have the certain condition, we will treat it. And then we're gonna educate the client how we're gonna save our results after the treatment. Does it make sense what I'm saying?
Oh, yeah, yeah.
So that's not only treatment, it's before and after as well.
Yeah, so it's the creativity is not just treating it, it's okay, how can we prevent, and then how can we make it even better afterwards?
Yes.
Okay,
yes.
Perfect. Now I'm sure, Olga, throughout your experience, you've probably run into some particularly challenging cases. So could you share a story of maybe one challenging case that you can think of, and how you were able to achieve that successful outcome from it?
Oh, I think for every aesthetic providers, there's a lot of challenges, but to me personally, when my client has unrealistic expectation from the certain procedures or the condition in their faces, it's very challenging to us, because no matter what you're trying to educate or explain, he or she has own idea what could be done. So for example, I never would do something which gonna go against my view and my own expertise. Let's say, client asked me to do lips and they already have full lips, and there's no way I can inject it more. Say no. This kind of population will go somewhere else. They will go somewhere else, they get injected, and then they have a problem. Then they will come back to me and say, you were right, I should not do it. It's almost to the point I want them to experience something else to prove that I was right. Of course, it's maybe not it's kind of harsh way, but there's no other way I can, no matter what I will say,
Yeah.
They will do it anyway.
Yeah. You're not going to convince them otherwise. They have to experience the pain, and they're like, okay, now I know why. But
yes, because sometimes we learn from our own mistakes.
Yeah, and sometimes they have to make the mistakes before they'll learn.
Exactly.
You can't tell them. No matter how much you tell them, they're not gonna listen. And then once they go through it, okay, now they listen.
Yes, that's true.
Okay, now Olga, I want to move over to the training side of your business. So you have a training arm of your business. So can you tell me a little bit about the training side?
So I'm allergen trainer. So I've been employed by Allergan to train on allergen products, but I also, the other half of our education center are private educations, sessions, which we've been very passionate about. So we train how to inject Botox, how to inject filler, and it's both for novice injectors and advanced injectors. We also teach different lip techniques. We teach mesotherapy, it's improving the skin quality. We teach PDO threads for skin lifting. We teach lipodissolve, which is fat dissolve. It's literally this much of classes we do. We do theory and hands-on training, and our students can also come back and follow the providers to see more hands-on sessions and practice more.
Got it. Now, what are some tips you can give to someone to grow their practice?
Of course, be educated at least about basic stuff. It's one thing. How to do neurotoxin dermal fillers, and know everything about skin types and what to recommend for the 6 different skin types. I would never, I will utilize the minimum in the beginning. For example, I would buy 1 or 2 laser devices a year, and then I work with that, like get to know this device better, get to know about like how much you can take from that equipment. Because the common mistake of a lot of new aesthetic providers, they buy a lot of devices and then they don't know how to utilize them. They don't know how to pay the stuff back, and then they go bankruptcy. So like, I think, have a mentor in their practice is very important. Somebody who has already multiple years in aesthetic business, they will recommend, what to do first, where to start.
Okay, so it's just a matter of needing to find that mentor.
Yes. I actually been a mentor for many of my students.
Oh, perfect. So they just come to you, right?
Yeah.
Perfect. Now, Olga, where do you think the future of aesthetics is going?
Oh, it's actually growing very fast, and I think we're gonna invent more and more natural, I think, uses of like we're doing PRP, PRF now. Then we're gonna use stem cells. Hopefully, it's gonna be approved in the United States. So use our own body as a resource for our future aesthetic treatments. So I wish, like, when we being younger, we can store some, stem cells, like in a particle of our hair, to grow in something and use it later in our life. So there is we eliminated in any allergy or any adverse effects. And of course, the laser industry is growing very fast. So hopefully we're gonna have less surgical procedure with more of aesthetic procedure. So now, even if you look at somebody's picture who is 60 years old now and looking 30, 40 years ago to 60 years old, it's a huge difference. It's like amazing how we were able to achieve, like in aesthetic medicine. And actually by year, I had this data on me, by year 2035, it's been guesstimated to spend almost $100 billion in aesthetic medicine. It's a huge number.
Yeah, that's a lot of money going into beauty.
I know. Beauty is a drug.
Oh, there you go. Now, Olga, I have one last question for you, but before I ask it, I want to point people to your website at www.bestfillerinjector.com. Now, the last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Good question. Because there's a lot of illegal providers right now. So you can check the medical license, find the license, you can Google it. You need to check your provider's credentials, because we either working with Allergan company, Galderma company, Merz company. You always can call the clinic and ask, what products are you guys using? They will tell you, we're using this and this. Then you can call official company and they will find the provider on provider list. If provider says, for example, we use an Allergan products, Juvederm, and they're not on provider list, they probably not buying the products from Allergan. They're getting it from somewhere else, from China or Korea. Yeah, so make sure, and then you always can look at Google reviews, Yelp reviews. There's always useful information. Ask your friends, where are you going to? Somebody's looking good, ask who's your provider. Perfect. So there's a lot of ways to check it out.
Got it. Well, there you have it, Olga sharing her expertise. Now, Olga, where can people contact you and your practice?
So we are located in Seattle, Kent, and Bellevue. Our phone number is 206-741-0000. We're also on Instagram. It's Best Filler Injector. And we're on TikTok, on Facebook. You always can find us there. The best way, of course, phone and Instagram.
Perfect. Great. Well, thanks for being on the show and sharing your message.
Thank you so much. Thank you for using my knowledge.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.